our panelists, both on-site and online, is something about patient access. Let's switch gears just a little bit and talk about what it feels like at the patient level. The person sitting in the exam room, the person in the ER, the person who's having a heart attack in their living room in rural and urban America. Dr. Barb, if I can ask you, from the American Medical Association experience that you've had, and really more so even as a family physician, why are we sending so many patients outside? We don't take care of them in our neighborhoods. Can you touch on those issues there, the distance?
Right, so it's a couple things. Number one, for better or for worse, and I think it is for better, we have much high-tech healthcare in this country. We have the best intensive care units in the world. We have the best technology in the world. And some of that, by necessity, does have to be housed or concentrated in tertiary care centers. However, there's a great deal of care that can be provided in smaller regional hospitals, particularly things like early stroke care. We've probably made more progress in that than any other critical time-sensitive illness. We've made a lot of progress in early detection of heart attack based on EKG and chemical findings, and we're able to get patients to a tertiary care center more quickly because we've been able to identify those patients better in the rural areas. So making, in my opinion, this is an overly simplistic answer, is making sure that we have those things in regional hospitals that can be properly done in regional hospitals, so that we take care of what we can locally and that we expedite transfer to a tertiary care center for those things that need the more sophisticated care that isn't, quite honestly, most of the time available in smaller regional hospitals.
No, very, very thoughtful. So is this a transportation issue, or is this just a lack of services in the area?
My opinion right now, there is some transportation issue, and telemedicine was already addressed earlier, maybe needs to be reemphasized. There are, especially with the aging population and with the economically challenged or poor, transportation and distances really make a huge difference to that population. Those in sort of the working age and kind of middle class, if you will, it's not as big a problem. Roads are better now, but I've got patients that I see. I live in a town of 5,000. It's 60 miles away from the nearest large hospital and 30 miles from the nearest small hospital. And there are folks that don't want to go, can't go. It's an inconvenience. They may have physical disabilities that prevent it, which is why the whole reason for this conference in part is to make sure we provide as much as we can, as close as we can to those patients. So while transportation is a barrier in some cases, I really think that it's timeliness and just immediate availability, particularly for the more vulnerable populations.
Okay, yes. Thank you, Dr. Barber.